absence of any other disease also, age can have a detrimental effect on the retina. So, sir, what detrimental effects do you find in elderly people?
So when we talk of age-related retinal or macular degeneration, generally, typically when you start to grow older than 50 years of age, it's then when the changes in the retinal photoreceptors and other layers starts happening. There are two types of changes. One is called a dry macular degeneration. There is a thinning or atrophy of the retinal cells, and the other is a wet kind of macular degeneration, wherein these blood vessels in the retina start to bleed, they start to form a membrane, and they lead to a sudden vision loss.
All right, sir. And do you feel that everybody over 50 should get a retina examination every year?
It's absolutely essential that everyone in India should get a retina screening after 50 years of age. There have been studies done in India where almost 50% of the people more than 50 years have been found to have some other kind of macular degeneration.
All right, sir. And what are the symptoms that one should look for in case they are around 50 or over 50 years of age, so that they may know there's a change happening?
So the symptoms which can indicate towards retinal macular degeneration age-related are: one, if there is a central dark spot coming in the field. Second is when you see that the lines which are straight appear to be wavy. Whenever you are reading an article, you're watching in the window pane, the straight lines appear to be wavy. And third, when the vision starts to become overall blurry. Therein, it's very essential that you get your retina screened.
And how do we treat those changes once they happen? Or can they be are they totally reversible, or can they be just contained and not reversed totally?
As I discussed with you, if it's a dry kind of macular degeneration, almost 30% chances of it progressing to wet kind of or leaking kind of macular degeneration is there. So when it's a dry, you have to take some vitamin supplements to strengthen the retina. And keep a close watch. Every 6 months get a checkup, or as soon as you develop any sudden symptom, you have to go to the retina specialist. For the wet kind of macular degeneration, you have to get some scans done, and depending on the scans, there are injections which are given inside the eye. These injections do help in preventing the further progression. Reversibility is not possible, but stability is the aim.